All committee members are here, Apazuko and Moda. Having technical difficulties. Are we ready? Okay, are we ready? This is Bill 89. What? I can't hear you.
Give you 3 minutes.
Oh.
I mean, here's the law. This includes prescription business, dental, which is negligible. Vision is different. Two and 6,000. Life insurance fluctuates pretty much with population, but it's within a range. Right, I'm on camera. Right. But, and the third thing, the other thing makes this story.
So that business.
Because I just looked at my scan. Yeah.
You have to get the headlines. Take the pressure off of me.
Just budget. So it's going to come in, so it's final.
Well, we're doing okay.
Right. Percentage is based on the yes. I think it's easier to do for us to. One of the things I know.
Okay, go ahead. I'm gonna just take more. Good.
Okay, committee is now in session. Mr. Hamlin has okayed it. Mr. Hamlin, do you want to read Bill 89?
Bill 89. Bill 89 amends the risk fund budget by transferring a total of $3,200,557 in the risk fund to cover employees' health benefits, and authorizes supplemental appropriation from the appropriate balance of the risk fund of $2,470,790 and transfers $584,757 from the fund.
All right. Our HR director. You don't mind if I call you Mallory, right?
No, of course not. So, what we have for you is an explanation of how our risk fund had been allocated. Why we're gonna take a look at both our risk expenditures as well as our healthcare expenditures. And then also we'll give you an overview of the countermeasures that we're putting in place for 2019 so that to avoid this type of a situation moving forward. So I have with me right here, I have Jeff Nelson, who is our manager of risk and safety, and I have Geraldine Garza, who is the benefits manager, and they're going to share their insights on specific slides. If we're not able to get the slideshow up, we do have copies of the slideshow that we can pass out to you.
Yeah, I'm not getting it up.
Okay, just a moment. We'll get you copies of the slideshow. I need one more.
Two more.
Two more.
For Jeff. Come on, show the controller.
So opening this presentation will be Jim Nelson, our manager of risk and safety.
Thank you for this opportunity. I want to start with saying that over the last several years, risk has attempted to protect against the volatile market when it comes to associating with risk. That began in 2016 with my predecessor. They started to attempt to build a reserve to protect the city and help offset the costs, the increased costs over the last several budget seasons. And this is why we're able to manage it somewhat with tackling our reserves and underfunding of the account. So with that being said, one of our biggest gaps when we transfer into it is to build on that process that was started in 2016. We started to identify our biggest drives, which was our legal liabilities. And as you see from starting in 2016, going into 2018, we have constantly increased, and that covers legal fees and lawsuit settlements. Additionally, what we did is starting in 2017, we started to monitor our direct internal losses such as floods, the explosion that happened earlier in the year, and other costs associated with items like that. As you see, those costs, as we start monitoring them and watching them, they have constantly went up. These costs are direct costs to the city because we do not have insurance in place to cover a lot of these costs. Additionally, one of the positive things from 2018 is with 2015, they started to track the auto losses and pay. We started working in conjunction with training, ensuring that the non-target items are appropriately charged to the city. And as you see, we're starting to decrease that as of 2018, with hopefully that continuing into 2019. So one of the things is I'm gonna go ahead and hand it over to our benefits manager who will talk about the next couple slides.
Hi, I'm Geraldine Garza. I'm the benefits manager, and I'm going to go over some of the slides to give some insight into the benefits portion of the risk fund. So the first slide is going to be associated with our high claims. This is one of the biggest drivers we have as far as health costs goes. So we have identified the 5 highest claims that were in 2018, and that we are keeping our eye on 2019. So you can see claimant number 1 and number 2 are the highest. Number 2 is at 296,000, the other one's at 1.3 million. We have a stop loss insurance in place, which is a huge benefit to the city. What that does is when a claim comes in at $250, that insurance, I'm sorry, $250,000, our insurance kicks in. From that point forward, the stop loss insurance pays the claims. So the cost of the city of that 1.3 billion is actually 250,000. If we didn't have that, we would have to pay the entire 1.3 million. So this slide here is explains the actual cost for the claims that came over into the city from 2015 up to 2018. They have gone up consistently every year. The medical market is very volatile. And the yellow bar is going to show what the city actually paid out for the claims. The reason we only paid, for example, in 2015, the 7.7 million as opposed to the 22.5 is that we are members of the Lehigh Valley Business Coalition on Healthcare. It's a group, it's 220 employers throughout this area, and they actually go in and help us with the programs that we can put in place. We get better pricing. From 2015 to 2018, we have consistently saved approximately 64% yearly over if we were going through someone else to get the benefits for our employees at the level that we're currently getting. This is the other factor that goes into our premiums, the prescription costs. As you know, prescriptions are also very high. This also is going to show you from 2015 to 2019 what was paid out for prescriptions. The yellow line at the bottom, those are rebates that we get. As part of the coalition, we have a contract with Express Scripts, and we get rebates on medications that we purchase throughout the year for our employees for their different illnesses and conditions. So as you can see, the rebates that we have been getting from them have gone up as well. This slide speaks on Teladoc. It is a real-time mobile app, gives access to doctors. We rolled it out mid-year 2017. So this particular slide is going to give you the data that we collected in 2018. Of all the eligible employees for this program in particular, only 22% are currently enrolled. Of that 22% that are enrolled and using it, we save $70,000 over the course of the year. It cuts down on emergency rooms or urgent care and things like that. Our plan for 2019 is to roll out a massive campaign to have our employees start taking advantage of this particular program. It comes free to all employees that are eligible as part of the benefits. It's a very good way to kind of start cutting down on some of the costs related. As you can see, we're only 22%, we save $70,000. So if we can get that number up, we could save more.
So before we move to this next slide, because we want to share with you some measures that we're putting in place for 2019, we don't want to be in this situation again next year. And so we are taking measures in order to really try to bring down the medical costs and some of the costs in the risk fund. But before we go to this slide, I'm going to share this with you in just a moment. Any questions or comments about the slides that we just shared?
I'm sorry, are there any questions from my colleagues from this? Mr. Reedy?
Thank you. Let me just go back. Just got a couple of questions. So on page 4, page 3, I'm sorry. Is this how much we actually spend per year on legal fees, on the legal liabilities?
Yes, sir. And including lawsuit settlements, so slip, trip, and fall settlements, excessive force settlements, any type of settlement like that, those are including those settlements.
So let's say 2018, we paid $2,275,000 on legal fees. Now, do we have a maximum? I thought that we used to have a maximum of how much we pay per occurrence, like somebody sues for some reason. Isn't there a maximum, well, how much we pay per occurrence?
That's depending on what the settlement is, what's going on in the courts. There's not a maximum. I'll have to defer that to the solicitor's office to handle that, because we work in conjunction together. But normally they're really, depending on if it's outside agency or internal agency, then that's a cost factor there. And depending on what is being sued, there's different revenues there that we use. We do have some insurances in place, such as our police liability. But now it's getting to the point where it's kind of all set and due. They're forcing us to settle more claims, which we're seeing more unnecessary claims come towards the city. So we're redoing our strategy when it comes to that type of claim handling from the solicitor's office.
So, he doesn't, I mean, I can't tell like how many actual claims we had and how much we're spending by looking at this. Do you have that information some way eventually?
We are working on putting that information together now so we can break it out into our accounts. One of the things in 2019 is we're using our accounts. One account, the 44 account, is only for legal fees, and then we have another accounts that is internal losses, our lawsuit settlements. That way we can separate the accounts and better tell which one are which, because the problem is up until 2016, everything was in one jumbled account. So over the last 3 years with my predecessor and continuing into our time at the city, we are now separating it out so we can be able to give you that better information.
Yeah, and the reason is because as you look into creating a process to reducing some of these liabilities, we want to know where they came from and what they are, how many they are.
So you will actually be happy to hear that we do have a tool that we're putting in place to help us track those things. We have a software initiative when we talk about areas of opportunity that will help us to track the various elements of the different,
So you're gonna talk about that?
yes,
Okay.
yes, that's one of our improvements that we're putting in place. You're right, it's really important for us to be able to track that information, to be able to monitor it, and that can help us build strategies to continue to reduce those.
Okay, and then I got one last question, so. On the last, on nine, slide, page nine, maybe slide nine. In this slide, this is a percentage of how much you actually spending, but I'm trying to figure out if you have a program that, if you go to, an urgent care, for example, I think you end up paying less than if you go to emergency care at a hospital. Okay? So do we offer that to our employees? Because it will reduce the cost of how much we actually pay, to the health benefits. I mean,
That is a great question, and urgent care is one of the options, depending on what plan you have.
Right now, our plans, all plans are able to go to urgent care, and they're also able to go to the emergency room. That is one of the areas we're looking for to change. Currently, if you go to emergency rooms, there is not a copay for that visit, so a lot of people opt out for that. So we're looking into changing the copay structure for emergency rooms. And this is also part of the reason we're pushing out the teledoc, because, for example, I'm in it and I have a child, he has a fever in the middle of the night, I can just call in and I got a doctor in 5 minutes on my phone, looking at him. And I don't pay for it, and the city doesn't pay for it.
so right now, the user, or the employee, doesn't pay anything at all if they go to a hospital emergency room?
Correct.
Gosh.
There is on some of the collective bargaining, ones they do have caveats in there where they have a cost related to it. But by and large, there is no cost, which is one of the cost saving measures that could be implemented. And I'm starting to look at it now to see what we can continue to offer, that is comparable to what we have now, and cost effective for the city.
When we do our areas of opportunity, we're presenting those things that we're doing in order to better position ourselves in 2019 so that we can reduce costs. And one of those things is looking at what plan changes we can make to keep our rich benefits. Let's face it, this is what we have that distinguishes the city. When we're looking for talent, the fact that we've got good benefits really is what attracts people into the city. It's one of those things. We cannot we still have to have good solid benefits. However, there are tweaks that we can make to the benefits that can save us a lot of money, and that's one example. And so we're using 2019 as a time to really focus in on these plans and say, what can we do to reduce costs but continue to offer good solid benefits?
And that's a good point. So
Yeah,
you
we're
can
doing
reduce costs and still offer those benefits, but at the same time, I mean, even we cut it like plans, everybody pays a little bit here, a little bit there. And I'm not, giving you any number, but we gotta start looking into that if we really want to save funds.
Absolutely. Now, let me tell you a little bit about Teledoc. Teledoc is an opportunity to save, even from urgent care. Yes, urgent care is less expensive, Teledoc is free. And what you can do is take your mobile phone and call up a doctor. A doctor can, they can take your, you can give them your temperature, they can look at symptoms, and they can write a prescription and send it to your pharmacy without stepping foot into a doctor's office and without the city paying 1 penny towards it. So you'll see in our areas of opportunity, right now, only 22% of the eligible people are using it. That's far too low. We've saved $70,000 with only 22%. So our plan for 2019 is to raise awareness. I mean, it's a great tool, it's a great way for us to save money, but it's also a convenience for the user who wants to go to the doctor if you don't have to.
You go to an emergency room, I've gone to emergency room, I can say personally, waited 3 hours before we were in.
And you were one of the lucky ones.
Well, it was for my son, but yeah. Yeah. And you go to an urgent care and they say
Yes, it's a lot faster.
And cheaper.
Yes, and cheaper. And then Teledoc is like that, but free.
That's all, thank you very much.
Mr. Robinson, or, Mr. Zuko? Yep.
I just have one question. Recently, you raised all the premiums for, the current employees as well, I guess, based on contracts as well, you know, that an issue, whether or not it got raised, but between the retirees and, of the current employees, their premiums currently increased. How much did that bring in toward this $3 million you're asking for?
So the raised rates are based on the rates that we're being charged for the premiums. Across the entire country, the rates go up.
I understand that. My question is this: how much of that increase of all the employees, retirees, et cetera, is a plus toward this $3 million you're asking for?
So this is for 2018, and the new rates are for 2019.
I understand that, but you're asking for a transfer.
Yeah, that's for last year. The transfers for last year.
The rates are for 19.
2018.
Yeah, it's a transfer within the risk fund from the reserves.
Would we be doing that? Okay, then maybe I'm misunderstanding this. Okay, that's good, thank you. Yes, I'm sorry, thanks.
Mr. Robinson?
Thank you, Madam Chair. On page 4 of the slide, Jeff, could you just sort of, with the direct losses, I know you touched on this briefly, but could you give us a slightly more detailed breakdown of what you're talking about with these?
When it comes to indirect losses, we had a couple floods last year, such as that happened at the former or current, where our Parks Authority sits, in the parks where they had a complete flood down there. Potentially lost equipment that would have been affected due to snowstorm there. And then we had trails that we had to replace. We had the bombing, unfortunately, down there off of Linden, and then a couple other things such as asbestos tested and industrial hygiene tested. We had asbestos abatement that we came back earlier in the year last year to rebate the whole entire central floor because of the pop tiles when it came to asbestos. So those are the type of things that we talk about when we say internal direct losses. Those are what we're referencing.
Right, thank you. I thought it'd be useful to have a slightly more descriptive. On page 5, so this is a pretty significant drop in the payouts that we have made here. What do you attribute that to, and what are you going to continue to do? As you said, you want to continue to see this drop. What steps are you going to take to try and get there?
I think the biggest is Craig Messenger and Messenger. Hopefully I said that right. Don't get in trouble with that. But hopefully his partnership with our department. He's him, Dale, now Dan Steckel, who they took from our department, are working together to constantly build on this process. We are holding Sinclair accountable for all the non-targeted calls. We're putting out RFPs, which you will see when we talk about the areas of opportunities to help control the calls that are not related into that contract. We're constantly monitoring, we're holding employees accountable, we're giving them trainings. Our supervisors from fire, police to just our normal streets and public works employees, our supervisors are holding people accountable, doing accident kits and things like that, I think is one of the driving forces, and hopefully we continue that in 2019.
Right.
We had a pretty big snowstorm, only had 2 accidents, and I think that's a pretty impressive to say what they're doing out there
That's
from a
great.
leadership perspective.
That's fantastic. On page 6, so when we talk about the stop loss insurance, what are our premiums and what are we paying for the stop loss insurance?
The stop loss right now is approximately $70,000 per month. So basically, anytime we have claims coming in, we monitor them on a month-to-month basis. So if you see like the 3 lower ones, we'll continue to monitor them. One is really close to the 250. So once he hits that 250 or she hits 250, that's when the stop loss insurance will kick in. And they send us rebate checks periodically, usually quarterly is more the frequency that I've seen since I've been in this position. So if the city overpaid, they would return money to us.
Once it's over the 250,000.
Correct.
And we only had 2 of those claims in all of 2018.
Yes.
Okay. So we're paying about a little more than $800,000 a year for it?
Correct.
What's it normally? I know this is, we're saying that this was a very high year in terms of unexpected costs. So when we're looking at a normal year, what's the baseline that we would look at this for in terms of any of these type of high-level costs?
I would say, claimant number 2 is a more accurate description of what we tend to see. When you see, claims that come in the 1.3 million, it's conditions that are more serious. Treatments are more expensive. So that's also part of the reason why we have that stop loss insurance in place to ensure that the employee continues to get the coverage that they have. None of our employees are dropped, and they don't have to worry about not having insurance at a time when they need it the most.
Okay, I'm just looking at it from the standpoint of year over year. This year, it saved us a few $100,000, but I'm just trying to look at it from other years where it could be a loss. If your baseline year is to not have claims over $250,000, then I'm not saying it's something we shouldn't do. I just like to try and track the numbers so we know exactly what we're doing. So did the stop loss actually result in a savings, or was it actually a net wash when you look at it over several years where perhaps we didn't have this?
I could get that information for you.
That would be great.
I didn't gather it today,
Sure.
but I can definitely get the information for you.
That'd be great, thank you. Because like I said, it makes sense to do it. I'm just curious how we're tracking it, so.
I will say that in my experience in human resources, that with a staff of about 1,000 people, you're very likely to hit your stop loss at least once or twice in a year.
Oh, great, that's why I said, Emily, I don't have an argument with doing it, I just like the data to see,
Makes
if for no
sense.
other reason than if it could give you guys some tools to negotiate every time, so.
Absolutely.
So on the next page, when we look at actual cost of medical, does this number include the payment that we make to 32BJ?
No, we left that out. This is for, every other group is SCRE.
Okay, so, I don't remember that number off the top of my head. What are we looking at in terms of an amount that we paid to 32BJ for the year? Just a ballpark figure.
We paid approximately $382,000 a month to them.
$382 a month, so we're looking at about $3.5 million more than is on this sheet is what our actual healthcare costs were for the
Correct,
year.
and this particular slide is really on the claims.
Okay, I see what you're saying, I'm sorry. Is there a reason we don't, since that's just the number that we pay them, and that's the majority of our unionized employees, is 32BJ. Is there a reason why we don't consider that an actual cost of medical for accounting purposes?
I could not speak to that. I don't know the accounting end of it. And we don't have oversight to that particular plan. It's-
Sure. I'm just looking at it as, it is an actual cost of medical for us.
Yes,
So
it is.
I did, Brent, I don't know if maybe you wanted to answer that?
When we run account 37, which is where all of the costs in the risk fund are with respect to health insurance, the 32BJ premiums, which at $380,000 a month come out to about $4.5 million a
Okay.
year, are included as part of that total. So what you're seeing here broken out is the portion that is everything else that we actually have some control over, separate from the SEIU, which is what they're breaking out in detail.
Okay, thank you. That makes it very clear. Okay. And my last couple of questions, on page 9, what is the plan that you guys have in place to try and encourage better use of Teladoc?
So we are doing a marketing campaign about it. We believe that people are not even aware of it. They're not aware that they have it, that they have access to it. And so we're putting together a marketing campaign, an internal marketing campaign, which includes incentives for downloading the app and also incentives for using it. And it will be a massive citywide campaign.
Okay.
We're putting the strategy together for that right now, and it'll be rolled out in February.
Do you have sort of a metric for success? If the number increases by X amount, it was successful. If not, maybe try something different and see where you can go from there, or not?
So right now, our metric is just the number of increases, of increased utilization. But I do like that idea of setting a target. Yes, we will do that.
Just curious on that one. And then the other thing is, so we talked about, when Councilman Greedy was asking his questions, the fact that we have no copay for emergency room visits for our plans. Do we know, is that in all 3 of the collective bargaining agreements that we have it set up that way?
For police currently, with their new plan, is no copay. For non-bargaining is no copay. For fire, there is a $75 copay.
Okay.
However, if the visit is deemed truly an emergency, the city does reimburse them that $75.
Okay. The reason I ask is because obviously if we're looking at trying, non-bargaining is a little bit easier, but with the bargaining units, that's gonna require either a reopening of their contracts or negotiation when the contracts are due, which means more than likely we're gonna have to give something to get something in that. So that's why I was curious if it was all of the bargaining units that had that. I have one last question. It's something, in terms of when we look at the high costs, the unexpected costs that we have, do we have any type of metric in place to track what these costs are so that we could see over the course of several years, X number of employees that work together all had similar medical conditions? There might be something to this. We need to look into this to determine, were we at fault, or more importantly, was a vendor that we utilized for a product potentially at fault, so that we can really look into this? Because this would be something not just year over year, but honestly, it could be decade over decade, really. So do we have something in place, or at least a plan to put something in place for that?
So the broker that we use to help us is BSI. They have tracking systems in place, so anytime I need any kind of information, I call them and they can help me pull the reports. And as Capital Blue, we have a system for them as well that we can go in there. It's for the entire coalition, but the way the system is set up, since we are one of the bigger members, I can go in there and extract information just on our population, and I could also extract information for the entire coalition population. So there are metrics that are in place, not necessarily housed in-house, but that we have access to.
And would that also include, since we just make a payment to 32BJ, would we also be able to get metrics like that from their members?
Unfortunately, 32BJ does not give us any information. I cannot even tell you who their plan is with.
Okay. All right, and then the last thing that I have is, there was, when the article from the Morning Call made its way to social media this morning, there seemed to be quite a lot of people who did not understand, and it is a complicated issue, so I completely understand why someone wouldn't understand this, but how it is that we pay for healthcare, but we are also self-insured, and how these prices could escalate to that degree. For the edification of not just the members of council and the public here, but for everyone who's going to see this when they watch the broadcast, could you give us just a very basic, very sort of Reader's Digest breakdown of how the insurance is set up and how it is that we do have Capital Blue, but we're also technically self-insured, and walk through that? So I think there's a better and clearer understanding for the general public as to what that means and what we're doing with healthcare and all forms of insurance.
So the way that it's set up, I'm gonna start the answer, but we have our resident experts here who are hands-on with it all the time.
Thank you.
So the way that it works is that we pay a premium to have access to the groups that provide the health care at the price that they provide it. And so those are the premiums, and that's what we pay every month to be a part of it. And that provides us with our medical doctor, it provides us with access to the hospitals and all of that to be covered. What it means to be self-insured is that when claims come in, you pay those claims. Because you're a part of the hospital, because you're a part of Capital Blue Cross, you pay the Capital Blue Cross price, as opposed to if you were self-insured, but you did not have access to Capital Blue Cross, you pay the full price. Not only that, we're also a part of BSI, so we get additional discounts by, if we were completely self-insured and going directly for healthcare ourselves, we'd have to go out and shop for that healthcare. We'd have to put all of the, find doctors to take what it is that we offer. We're not in a position to do that. So we pay a premium to Capital Blue Cross to do that for us. We pay a premium to BSI to help us get the best rates. But we pay the claims, and it's less expensive for us to pay the claims ourselves than it is for us to use them to pay the claims. So we're doing what is most cost effective in terms of offering health insurance. I don't know if you want to add.
That was great, and I appreciate that, because like I said, I think it's something where when you're just reading it quickly with no explanation behind it, it can get a little confusing, and as all of you know, one of my things is making sure that we educate people as we go along. So I appreciate that. I thank you for the questions. As we move on, I'm sure I'll have one or two more questions, but for now, that's all. Thank you very much, Madam Chair.
Oh, I have any more comments from my colleagues?
I just have one more question. We just did the budget. I guess I'm kind of curious why this wasn't caught at the budget, that we have this shortfall.
So the timing of the bills, some of the bills come in after the budget is done. Some of these bills don't even come in until January, but they're still for last year.
$3 million worth?
Thank you, Mr. Zibble. The trend that I started noticing this year on the costs actually happened earlier on in the year, and I was starting to see it dropping hints, I think, during some of the council meetings over the late summer, that we were seeing trends in the costs that were running higher than they should have been in the earlier part of the year. Once I saw that that was the case, I knew that we had a strong tendency a strong likelihood that we were probably going to run over for 2018, and it became obvious that it was going to run into seven figures probably in the early autumn. At that point, I had a decision to make in looking at what we had available in the risk management fund to see if I thought in good estimation that we would have enough money to cover that for the remainder of the year. And based on the cost patterns that I was seeing, I made the judgment call, and it turned out it was right, that there was enough money to cover that excess in the risk management fund without having to go to the general fund to do it. But there were signs by midsummer that we didn't appropriate enough for it for 2018. And for 2019, we're going to need to be similarly careful that if we see trends that are going to be in excess of what we see, we're going to need to deal with it in a more expeditious fashion.
I believe it was $700,000 we appropriated toward lawsuits and legal fees, $600,000. Back then, was that in addition to this?
Yes, that is, and that appropriation came out earlier. We were before we brought this one forward, we wanted to get a real estimate about where we thought we were going to end up on the healthcare costs, which is now why we're bringing it together in one package. But yes, that $600,000 that was approved for that was a separate issue altogether, yes.
And I guess my other question is for the control. Do we have that number in the risk management fund that you have?
Yes.
Okay. All right, thank you. Ms. Hoffman.
Anyone else? Ms. Miller?
I was gonna ask the same question. So if you saw that there were like, red flags and things were going up, I think that, I don't really recall us, talking about it really. I mean, it would be nice to know ahead of time during budget season that things were gonna, be so high.
Thank you, Ms. Moda. And yes, that consideration was, I think, at a root of what we were trying to budget appropriately for 2019 in this regard. The amount that we budgeted for 2019 was considerably higher than what had been budgeted for 2018. It may not be quite sufficient to get there, and we're going to make sure that we cut costs as much as we can so that we don't have another issue like this happening at the end of this coming year. I could have been more clear about where I thought the overall trends were going to go probably in the autumn. I saw that I took the view, which was right, that we had enough in the risk management fund to cover it over, but some more clarity on that would have been appropriate.
But can you tell me what are the trends that you were looking at? Like, what happened?
I take a look, as does the controller, at every single health care bill that comes through the city. And the things that drive these costs are primarily the monthly payment we make to SEIU for their coverage at 32BJ. And what we are paying out to Blue Cross, Capital Blue, in terms of those costs. Usually with Capital Blue, there is a fairly steady amount that we're paying every 2 weeks for those particular costs. There were a couple of blips in May and June, where the cost, instead of being like this, went like boom. And it went up there for about a month and then came back to what that overall amount generally was over the course of the rest of the year. It went back to being steady. Because of that bump in about May or June, I realized at that point that we were going to be running, I expected, beyond what we had budgeted for the course of the year. And that's when I was indicating, the way I went about it at that point was to say I was certain we were gonna have enough in the risk management fund to be able to cover it if we needed to go to that point and not touch the general fund. But there were signs as of midsummer that we were going to be going over.
Wow. Thank you.
Mr. Henry first here, and I'll get you, Jeff.
Thank you, Madam Chair. Melanie, and this question for you or perhaps for Jeff Nelson. I've received several emails and several phone calls from retirees from the police department. And one of which mentioned that his increase, cost for medical increased $62.17 a pay for a total of $1,662 or $1,616 as his share increase. Now, being that they pay 25%, that's an annual increase of his healthcare costs of $6,465, which seems extremely excessive. And I don't know if it is or not. I know I've sent emails to our city controller, yes, and he's looking into it, I believe, with your staff also. One question I would have, first of all, we need to find out if this is correct, if there's any type of errors. And secondly, I would ask that in the future, when there is such an increase, that some type of correspondence be sent to the officers. I think those type of increases are significant and bring a lot of questions. So questions of doubt, are we doing the right thing, or is there a mistake here? And at least at minimum, I think we need to give them an explanation as to why the increase is. And although it may not be, they're not going to have to about it, but at least maybe they'll understand better.
You're absolutely right. We should have sent a communication to our police retirees ahead of time because they do pay that 25%. And so everyone's rates went up significantly, but they would feel it the most, I think, because of their situation. What we are working on now, because we've gotten a lot of phone calls, we've gotten a lot of people stopping into the office, and also others. I think you all have been getting calls as well, the mayor's been getting calls. So we're working right now on a communication to go out to all police retirees explaining it. I think where we really should have approached it differently is giving them the heads up so they would know what to expect. We're going to send out, we're working on it now, it's gonna come out next week sometime, a communication to say, hey, we know that this is a challenge, here's why the rates are higher, and giving them that detail. And then moving forward, our communication, this will inform our communication for open enrollment next year. Not just for police retirees, but for anyone whose rates are going up. We did a lot more communication this time than we've ever done prior to open enrollment. But that's a piece that we should have also incorporated into that communication. So our eyes are on that. It is a concern for us as well. I mean, the police retirees, they're on a fixed income. So those higher rates are impacting them probably more than most. We are gonna communicate about it for next week.
What I found interesting, during the budget process, we had the one employee in the under community and economic development, and it showed an assessment of $25,000 for healthcare. And then as it was explained to me by Mr. Hartzell, that included retirees in that amount, that wasn't only for one employee. And yet, what I've heard from some retirees is they're paying as much as, again, going by 1/4 of what they're responsible for. It calculates out that their assessment would be $33,000 per member, which is far above the 25,000, and it just seemed kind of hard to believe.
So different people are on different plans, and I think that's where there are some challenges, like trying to compare one employee to another, trying to compare a person in one retiree pool to another, people have, different groups have different plans, and so the cost for their benefits varies.
And I understand that, it just seemed like, again, we were talking about 25,000, and I believe this employee would be under a family plan, and for that amount of money, and yet that was explained that didn't only include that employee, it included retirees in it. That how can we then have a retiree who should be separated from anybody? There shouldn't be retirees in under that cost. For that to be that high seems excessive.
I'd actually have to see the document that you're talking about to be able to understand it and try to
All
explain
right,
it.
I'll try to have that person contact you with
Okay.
that information.
That would be helpful.
All right, thank you.
Thank you.
Thank you, Madam.
Mr. Blazer?
Thank you, Madam Chair. I just want to pick up on, Mr. Hartzell was asked about the timing of this and when the trend became apparent, and Mr. Hartzell had mentioned there were some big bills in May and June, which is correct. But the biggest bill didn't come until October. That was almost $4 million, and, I mean, for the month as a whole. And, you know, until the financial report comes out, and because we were in budget season, that probably would have been toward the end of November. So in terms of, you know, sounding the alarm, I think timing definitely worked against that. I would like to clarify something. We use the term budgeting for this line. Some costs can be very accurately budgeted. We know about how much gas we're going to use every year. We can budget that appropriately. We're not sure exactly what our health is going to be every year. And so it seems to me what the HR has done over the number of years is look at the past year's experience, see if the providers have said they're getting any definite increases, put the two together, and then come up with a budgeted amount for the next year. You know, because we're self-pay, the experience this year is what the experience is, and we're gonna pay it. And hopefully next year won't be any worse, hopefully it'll be better. But, you know, they're giving us the best estimate that they can give us, and council, you know, has appropriated that money.
Thank you, Mr. Blazer. Anyone else? All right, I'm gonna open it.
Can we share our areas?
Oh, I'm sorry.
So we have, and I'm gonna go through this really quick because we've talked about a few of these already, but I just wanna share with you the measures that we're putting in place or that we have put in place in order to improve our costs. So one of the things is we're auditing, Jerry has a monthly auditing process for, our healthcare invoicing to make sure that, every invoice is accurate, that now we get some help from our broker with that, but we also have some measures in place with Jerry and a couple of the other team members. We talked about Teladoc, increasing the use of Teladoc that will drive our costs down. We're focusing on specific healthcare factors. You'll notice we have monthly wellness education now, and the objective of this education is to help people develop more healthy behaviors, including also a healthy newsletter that comes out quarterly. Again, we talked about looking at our plan structure to see what we can do to drive down costs. Jerry talked about the emergency room as one example. We're also looking at our claims tracking and recovery so that we can better manage those legal costs. We have a software that's coming online called Industry Safe that will help us track those things and keep those costs down. We're also looking at improvement around ergonomics to help keep our employees healthier and drive those claims down. And then also cost control measures by doing RFPs for in some areas that we may not have done in the past, like hazmat and auto body repairs. So just some measures that are in place or on their way in place in order to drive these costs down.
Thank you. Is that it?
That's it.
Report? Any other comments from what she had just spoken on? Mr. Robinson?
Thank you, Madam Chair. So when we talk about creating the new audit process for healthcare invoicing, will you be including the controller in that since he works with all the health insurance bills as well?
Absolutely, we have an audit scheduled with them in February.
Great, thank you. When we were looking at Where's that? Oh, here we go, I'm sorry. When we talk about the RFP for hazmat and RFP for auto body repairs, as far as the hazmat goes, we're talking about any type of remediation work we do?
Yes, sir, try to control it. Like example is, we have people that likes to leave, buckets of unknown material in our parkways. Instead of paying $5,000, $3,000 for them to come out and pick it up, working with the purchasing department, Jessica and her team, and then also with the fire, creating a RFP that had hazmat to pick cost control, so we're not paying so much. We're not paying the premium, we're paying what anybody would pay when you set up a contract.
How does that, so you use the example of something being left in the park. How does that work with our hazmat team through the fire department? Are we
So-
utilizing them at all, or is that not something we can in this instance?
We utilize them just to stabilize the event. The problem is the city never had a process to handle the transportation and the cleanup, as we had it on Christmas Eve earlier this year, where we had somebody that had abandoned oil on the side of the road and just dropped it off. That comes at a cost to the city, and we have to handle that cost.
Okay.
So Mike Matchett is one of the guys that, has been involved in that process and helped us
Great.
out.
And with the auto body repairs, the Centerra contract was something that was voted on before I got on council, so I'm not as familiar with that as some of my colleagues might be, but there's no provision in the contract for body work?
It's specialized body work, would come in with fire trucks, police cars. Sometimes things get sent out. We have one thing Craig pointed out to me is in the contract, they charge us $35 per hour, but when we outsource the work, we're paying that higher premium. So if they're not able to do something, or they're not able to handle anything at that time, I wanna have another cost control mechanism in place, so we're not paying $115 per hour for a technician to work on it, but another reduced rate that we can control.
That makes sense, but I would also just ask that we keep a very close track of that, so when the contract comes up again, we can make sure that we have all the information we need as a body to determine whether or not they're the right vendor, another one is, or bringing it in-house might end up being a cost savings. So if we can make sure to really track that information, please.
Yes, sir. And Craig, just the Public Works Director and his team, Dale and Dan, they are already creating an audit module that we're with us on a monthly basis to ensure that we're tracking every item and everything is documented, so you'll have that information when that comes up.
Fantastic. I just had one or two questions about Bill 89 itself. Mainly, actually, it's really just one question. If you could just give us a rundown on the money that we are looking to take from training, professional development, and other contract services. I know it's not a lot in comparison to the overall number, but one of the things that I am sort of hoping that we can change as we look later tonight to some of the budgetary process and stuff is, when we look to do transfers like this, a better explanation of what allowed the money to be available, and then also, are we looking at then, this is gonna be a cost transfer from what would have been budgeted in 18 to now what is budgeted in 19? And just sort of looking at what was freed up to make this money available so that we could transfer it, and are we gonna end up having to spend this money again in 2019 just because we didn't spend it in 18 on these projects? I didn't exactly word that question properly, so I apologize if it wasn't clear.
I think I get what you're hitting at. What we did is with Brent, and when Mel came on board and Jerry and us, when we started realizing the cost of what risk is gonna be, we started putting some mechanism in place to lower the overall cost so we don't get into that budget. With this administration, we put, I believe, in my opinion, the first real budget for risk out there, so we can measure that out and have a more accurate number going forward into the future, so we can be accurate on what we're doing. But these items was something that we decided on to help mitigate our costs, to try to lower it, so we're not dipping into the general fund, but really focusing on the risk fund, even though it's very low, and we have to rebuild it back up. But ideally, that's what we'll do going forward.
Okay, so what was it from training, professional development, and contract services that we did not spend the money on?
So there's trainings that we eliminated for the risk and HR team throughout the year, and then also our self-insured losses, which is our workers' comp. We've actually been doing pretty good with PMA and EHDs, who's helping us with that, helping lower the costs overall. So we didn't have that many significant work-related issues last year, so that was able to taper down and help have that reserve built up, so we can have something to help with offset that 37 account.
Okay, and the trainings are something you guys, I assume, will look to do this year then?
Yes, sir.
Good. And with the self-insured losses, the 570,805, was that everything that was left in the account?
Yes, sir.
Okay, All right. And then the only question I have remaining, I don't know if Jeff, you would be the right one to ask this, or if Mr. Hartzell would be, which is the remaining balance after this transfer and the payment of the $3 million is made, what's going to be left in the risk fund unencumbered balance?
That's not true, but it is obviously going to be very slim. The December financial report, which we're about to talk about, the Finance and Tax Committee meeting, is showing a current cash balance as of December 31st in excess of $800,000 in the fund. I think there will still be a couple of other expenditures tied to 2018 that are forthcoming. I have been going with the idea that we're probably $400,000 to $500,000 on the positive side, still in the balance of Fund 81 at December 31st.
And when you say that 800,000, Mr. Hartzell, are you talking, did you already take into account this move and any payment of this move?
Yes, sir.
Okay, so we're looking at the balance, you're saying somewhere in the neighborhood of roughly $400,000?
Yes, sir.
And what's a safe number for you? What would make you feel comfortable with that fund balance is at?
I'm always glad to have a number there that's obviously positive, but we're going to have to be very careful over the course of this year to make sure that that number, if anything, goes up from that point. That's a very thin margin to work with in that particular.
Well, no, absolutely. Is there a number that you would feel comfortable with? I know we've discussed that with our budget size based off of accepted accounting standards, our unencumbered general fund balance should be roughly $17 million, to be perfectly safe. Is there a similar number for what our risk fund should be at, a similar accepted percentage?
I am not familiar with, there may be something that is spoken to at that point, and I have not looked at it specifically with that regard.
So is it safe to assume that as we begin the budget process for 2020, that looking to try and divert some money into this balance in the risk fund will probably be a safe bet for the budgeting process?
I would lean that way.
Excellent. Thank you very much, Mr. Hartzell. Thank you, Jeff. Thank you, Madam Chair.
There's another question from Mr. Hendricks.
Thank you, Madam Chair. Just a request, in light of this shocking amount here that we're paying, I would ask this of you and of the administration, if you could, on a quarterly basis, keep us appraised of where we are at, what we're looking at, and hopefully we're looking at a drop in cost to us. And I know that's probably not realistic, but I think it would be, and I realize that we probably wouldn't have known that anyhow till very late in the year about this. But if we just have that going forward, like maybe every 3 months, because it may be something we don't pick up on. Certainly you're gonna know more about those trends than we are. I just think it'd be a great way for us to keep on top of it and that we aren't, shocked at the end of the year with such an amount.
Absolutely, we
I
can do that.
appreciate that. Thank you. Thank you, Madam Chair.
My colleagues have really asked some great questions, and you answered a lot of those. I just have one. I'm interested in this teledoc. How long has this been in existence? And,
The programs have started nationwide a few years now. Teledoc was brought on to the city in 2017. Was before I was in the position. I want to say it was probably around mid-year. That's why I did not include any of the documentation data on that, because there really wasn't a lot of documentation. Like I said, I use it personally. I love it, and I do tell as many people as possible about it. So we have a lot of hope that this will start catching on once we do our marketing campaign.
and you did mention that we have 22% that are using it, and you mentioned how much you saved. I didn't write it down, so would you repeat it?
70,829, I believe it was, just shy of 71,000.
This is what we saved from people using this.
Yep, according to the data that was collected, each call that was given to Teledoc, it's a $517 savings.
Well, that's
Because
wonderful.
You don't actually go to the doctor's office, so you don't have to cover all that overhead that comes with all that kind of stuff.
I think one of the tricks to getting this to work is we're all creatures of habit. So how do we change habits? And one of the things we've talked about is incentivizing. So we started an incentive program just to get people to, it's almost like a taste test, right? You taste it a couple of times, you create the habit, you like it, you'll continue it. So that's what we're going to work on.
That's good. That's a great, this is great. It saves us a lot of money. Oh, there it is. Oh, big letters right here. Okay. Thank you, Mr. Hendricks. All right, thank you. Anything, oh, I'm sorry. You have to sit down. We're not finished yet.
Really quick. I think that one of the key here is prevention and training. And I think that, I like what you were saying, that you're planning to implement more wellness. I saw a couple of weeks ago that they sent from the city a flyer that had to do with exercising, you know, that if people were interested, they can join. I think that wellness, you know, I think that is also the key. So if you prevent things from happening, then we won't spend, you know, that amount of money. So I think that it is very important that we pretty much find out, you know, the data, why it was so high, you know what I mean? Especially those 2 months. I was wondering what was going on, you know? You mentioned what, May and June, that you saw I'm wondering what went on in those 2 months, you know? But yeah, I think that the key is training and prevention. Thank you.
Anyone else? Because Mr. Hirschman is chopping it a bit here. Come on up, Mr. Hirschman. State your name and address, please.
Thank you, Mr. My name is Lou Hirschman, 405 North Gilmore Street. My question is on the birthday rule. I guess you on the birthday rule and you pay benefits.
Sorry?
Birthday rule. You know, when two people have a benefit, and one's born in February, one's born in April, the person that's born in February is responsible for the bill, for their dependents. And Mr. Riddy, we take for an example, is works for Steve Allen, and he's born in April. His wife works for Enterprise, he's born in February. And then the birthday rules, and you told me you would verify invoices. And the birthday rule, what would you pay? The doctor submits the bill to the city of Valentine's and we're self-insured, but it's Julio's son, and maybe you should have submitted it to Enterprise under the birthday rule. The earlier person birthday is responsible for the bill. Does the city check the invoices on the birthday rule?
Lou, how old is the birthday rule?
It's birthday rule.
Okay, how long has it been in place?
It's been in place ever since I know, unless it went out this year.
Well, I know, I've heard people tell that if you work at Air Products requires you to go, that your spouse has to go to their own insurance plans before they go to Air Products. So if that was
She
the
mentioned
case,
Blue Cross.
well, you just used Julie as an example, so if that's true,
She
then.
brought up the Blue Cross, and that's what, when I was controller.
I'm trying to
we had
understand,
Blue
though.
Cross, and we always check the birthday rule on all payments.
I could speak to that. We have that in place. Capital Blue monitors that for us as well. That is just common practice in the healthcare industry, the birth rules. So if, for example, my husband has insurance at his place of business and his birthday comes first in the calendar year, then it would go for my son. He would be primary and we would become secondary. So those mechanisms are in place.
You said, so in other words, we're trying to control costs, so somebody is monitoring the birthday.
Yes.
One other question, city employees, when they call in, they only renew their benefits if they call in, if there's a change, am I right?
This year we did what was called the passive enrollment. In previous years, open enrollment has not gone smoothly. So this year I'm a new manager, I decided to try to implement something new to make employees not have to stress out so much about what they're gonna do for their employee, for their benefits.
See, my question is, I know city controller, once or every 2 or 3 years, I think maybe the current controller does. Some people, they move to Florida, and we never know if the spouse is deceased. And if they don't call up and make the change, the spouse or the city employee continues to get the benefits. Do we verify that a widow or whatever of the city employee does not get the benefits of a deceased employee?
Yes, we do. As soon as an employee passes away, whether they're active or retired, the benefits are cut off effective the date of passing for any dependent.
Thank you. Any more from the public? Seeing none. All right, can I have a motion to send this favorably to full council? Ms. Miller, Mr. Zucco? like to send a favorably to council. Do I have a second?
I'll second.
Okay, it is now moved that we will send this to, he seconded it, hear that, okay. We'll move this favorably to council. That's it. Okay, thank you, the meeting's over.
There was no vote. It was just a motion and a second, there was no vote.
Oh, I'm sorry, can we vote aye?
Aye.
All right. 3 ayes, yes. Meeting is now adjourned.
Okay, we're gonna start the budget and finance meeting in about a minute, couple of minutes.